Hi guys, I think we are live. Hi Dr. Jay, you can introduce yourself.
Good morning, sir. Good morning, Deepak Marwah, sir. Good morning, Dr. Apurva Mehra, sir. I am Dr. Shah. I am from Ahmedabad, BJ Medical College. I got a rank of 24 in NEET PG, and I am a first generation doctor in my family. So it was a good moment for me.
Great, आपने बहुत
I
बड़ी
think
बात
you
बोली.
can call it great. You can absolutely call it great. It is thrilling. It's
Thank
a
you, sir.
thrilling rank, sir.
फर्स्ट डॉक्टर इन द फैमिली को हमेशा डाउट होता है कि भाई मैंने अपनी जिंदगी में जो कर रहा हूँ वो सही है कि गलत है, कुछ और कर लेते हैं इससे अच्छा तो. So I think Jay, you have said a very important point for all the young doctors who are the first doctors in the family, that they are doing the right thing in their career and they are on the right path and they are on the right track because they're destined to save somebody's life and destined to be doctors. क्योंकि और कुछ कर नहीं सकते वो. So Jay, let's listen to your journey. How did you start with PrepLadder and how did you use the modules?
I joined PrepLadder during my second year. First, I bought an individual app for pathology in my second year. And after that, during my final year, I brought the entire PrepLadder. And it has helped me a lot throughout my journey. The MCQs are very well structured. They have a clinical vignette type of MCQs only, which help you to think. And this is important because during exam the time is, you have to manage your time properly. So if you practice MCQs the way they are asked in exams, then you can manage the time properly. I have many friends who told me that they weren't able to attempt all the questions, but I didn't have such a problem because I practiced the MCQs well.
तो टाइम मैनेजमेंट आपने अच्छे से मैनेज किया. तो हम स्टार्ट कर लेते हैं. से ऑर्थोपेडिक्स को आपने कितना टाइम दिया होगा इन योर फाइनल मतलब अभी जब एग्जाम से पहले, हाउ मच टाइम डिड यू डेडिकेट टू रीडिंग ऑर्थोपेडिक्स और मेडिसिन, दोनों का पूछ लेते हैं.
Sir, during my first trade, I actually spent about 7 days in orthopedics. That was during final year when I made the notes and everything. And during my internship, during the first reading properly for NEET, I took about 2.5 to 3 days, and subsequent revisions were 1 day. And during the last 10 days, half day, I tried to revise the important topics of orthopedics. And for medicine, sir, it was definitely not too long, but it's long. So during final year, what I used to do was first I used to watch the videos, and then I used to read Harrison. So उसके दो एडवांटेजेस थे कि आई ऑल्सो यूज टू नो कि कौन से टॉपिक्स इंपॉर्टेंट है कि जो मुझे हैरिसन में से पढ़ने चाहिए, बिकॉज एवरीवन सेज कि पूरी हैरिसन नहीं पढ़ी जा सकती. And if you read those important topics, it definitely gives you an edge. So my preparation was started from final year itself. And sir, I would like to thank you very much, because sir, I was a little bit weak in medicine, but after watching your videos, वो कहते हैं ना, एक अंदर से मेडिसिन के लिए आग जल गई.
आग जल गई. ओके ग्रेट. तो डॉक यहाँ पे उस मेरा एक छोटा सा कोई क्वेरी है ये वाला कि जैसे बहुत सारे बच्चों की फाइनल ईयर में मेरे पास क्वेरी आती है ये वाली कि हम पहले टेक्स्ट बुक पढ़ें फिर वीडियो लेक्चर सुने. और आई थिंक ये सब सब्जेक्ट्स के लिए वैलिड है कि मतलब जैसे टेक्स्ट बुक अगर पढ़नी है तो पहले टेक्स्ट बुक पढ़ के फिर वीडियो देखें या वीडियो देख के टेक्स्ट बुक पढ़ें. तो आपने आई थिंक जो आपने अप्रोच बोली वो एक बार आप रिपीट कर दो ताकि एवरीबॉडी इज क्लियर अबाउट कि कैसे करना है ताकि रैंक 24 डॉक्टर जे के जैसे ला सके.
सर एक्चुअली दैट वाज एन इंडिविजुअल टॉपिक वाइज मैं अप्रोच करता था. जो टॉपिक्स मुझे टफ लगते थे, लाइक आई फाउंड कार्डियोलॉजी टू बी टफ फॉर मी, ईसीजी रीडिंग एंड एमआई, then in CVS topics like stroke, those topics were a bit tough for me. So first I watched the videos, so I know कि इस टॉपिक में मुझे क्या क्या चीज पढ़नी है, so that I can focus my time on reading those topics from Harrison. Rest some easy subjects, topics like GIT, I read the book first and then I watched the videos, because in GIT I also have a little bit of personal interest. I like GIT more than CVS.
So Jay,
was there a sequence that you followed during internship to prepare or revise? Like many a
Yes,
times
sir.
in poly, people do final year, then second prof, then short subject, then first year. What was the sequence that Jay followed?
Yes, sir. So for final year subjects, I did all the final year subjects properly in final year itself. So I was sure कि एक बार internship start होगी तो इसको मैं last में करूँगा. And so internship start होते ही I started with the subjects that I found कि अभी ये तो भूल ही गया हूँ मैं. Like for example biochemistry, then pharmacology, then forensic medicine, PSM. I revised those subjects first, because those are volatile subjects and hadn't revised them quite in a long time. I revise मतलब जब prof में पढ़े थे तभी पढ़े थे, उसके बाद revise नहीं किए थे. So first I did those subjects and then I at last I came on to final year subjects.
All right. One more thing, Jay. You said that the MCQs in PrepLadder are very systematically given.
Yes, sir.
So were you doing MCQs along with the subjects? Number one. Were you giving grand tests frequently? Number two. And if yes, how frequently?
Yes, sir. For MCQs, what I did was that every topic that I used to read, first I used to see कि QBank में वो topic किस हिसाब से दिए हुए हैं. Like I'll give an example of medicine. That medicine there are 3 modules for ECG. So I will first read the topic of ECG, understand it properly, and on that same day itself, I used to do all the 3 modules of ECG. Likewise, I approached the entire QBank topic wise के जो topic जिस दिन पढ़ा हो उसी दिन उसकी QBank solve हो जाए. And so the advantage was कि जब मुझे revision का time था, then I used to watch only the bookmarks ही बाद में solve करता था. And regarding grand test, sir, I was a bit
एक बार बस इंटरप्ट कर रहा था, सॉरी. उसमें मेरा क्वेश्चन ये था कि जैसे फर्स्ट टाइम जब क्यू बैंक करते हैं तो कितना स्ट्राइक रेट कितना था? क्यों क्वेरी आती है मेरे पास में कि सर 40-50% ही क्वेश्चन सॉल्व होते हैं, तो डिप्रेशन हो जाता है कि नहीं आता तो छोड़ देते हैं. तो आपने जब फर्स्ट टाइम किया तो कितना परसेंट आप सही कर पा रहे थे आफ्टर लिसनिंग टू वीडियोस वंस या रीडिंग द टेक्स्ट बुक वंस? जब आप क्यू बैंक कर रहे थे फर्स्ट टाइम तो फर्स्ट बारी में स्ट्राइक रेट कितना था?
Sir, that was also dependent on topic. Some topics I used to score between 80 to 90%, but some topics were there in which I scored only 40. Sometimes it was bad like 20% also. But then I used to focus more on those topics. मुझे पता चल जाता था कि ये मेरा weak spot है, तो I need to work on it.
तो मतलब 30-40-50% से घबराना नहीं है, मतलब वो होता ही है. फर्स्ट टाइम करते हैं तो मोस्टली लड़के जो हैं, बॉयज एंड गर्ल्स, वो थोड़ा डिसइल्यूजन से हो जाते हैं कि यार ये तो 40% ही आ रहे हैं, तो शायद कुछ इनसफिशिएंट है. फिर वो एक ही चीज के मल्टीपल सोर्सेज ढूंढते हैं और फिर वो मल्टीपल उसी चीज को 4 जगह से कर लेते हैं. उससे आई थिंक वो अप्रोच गलत होती है.
यस सर. सर दैट डिटोरिएट्स योर रिवीजन. फिर रिवाइज नहीं हो पाता सब. एक बहुत कुछ एसिमुलेट कर लेंगे तो फिर रिवाइज कुछ हो ही नहीं पाता है. सर, you raised a good point. I would like to tell all my juniors stick to one source. जिस सोर्स से एक बार पढ़ा है उसी को बार बार रिवाइज करोगे तो मेमोरी अच्छी रहेगी और एग्जाम में रिकॉल भी आसानी से होगा.
Okay, Jay.
Yes, sir.
My question to you is, you said revision is very, very important, right? When did you start revising?
Sir, my first reading was over by September, October. So I started revising in October, mid-October. And first exam was going to be conducted in March. So that time I had planned only 1.5 revisions. But then when exam got delayed, I did 3 revisions, progressively decreasing the interval. Like my first revision was about 2 months. And the next 2 revisions were 1 month each.
What do you mean by 1.5 revision?
सर, मतलब जो सब्जेक्ट्स में मुझे कॉन्फिडेंस था कि ये रिवाइज नहीं करूंगा तो भी मुझे एग्जाम में याद आ जाएगा, दैट सब्जेक्ट्स आई केप्ट ऑन साइड. रेस्ट वॉलेटाइल सब्जेक्ट्स मैंने प्लान किया हुआ था कि ये तो पढ़ के ही जाने हैं एग्जाम से पहले, लाइक एफएमटी, पीएसएम, देन बायोकेमिस्ट्री, like that.
Wonderful, wonderful. Sir,
जे एग्जाम से 1 महीना पहले कितने घंटे रोज पढ़ रहे थे?
सर कोई फिक्स नहीं था. many juniors have asked me this. I used to tell them कि hours are not important. तुम्हारा जो दिन का गोल है वो तुम अचीव कर पा रहे हो या नहीं, that is important. कभी कभी जल्दी खत्म हो जाता था तो I used to relax and watch some shows or movies. बाकी के टाइम अगर नहीं होता था खत्म तो I also did not get demotivated. So I would shift that to the next day.
चलो हम वीक का कैलकुलेट करते हैं, एक वीक में कितने आवर्स आप स्टडी करते थे? मतलब आई अंडरस्टैंड फ्लक्चुएट कर रहा है, कभी 2 घंटे होगा, कभी 10 घंटे होगा। तो अब अगर जब सीरियसली पढ़ाई हो रही थी, मतलब व्हेन रियली प्रेशर कुकर सिचुएशन जिसे बोलते हैं, उस
Yes,
टाइम
sir.
पे एक हफ्ते में कितने आवर्स आप क्रंच कर रहे थे, डेटा क्रंचिंग कर रहे थे?
Sir, on average 10 hours a day.
वाह, मतलब 70 घंटे एक पर वीक इज
Yes,
व्हाट
sir.
यू वर मैनेज।
Yes, sir.
ओके, और आपने एग्जाम में कितने क्वेश्चन अटेम्प्ट किए टोटल?
Sir, I attempted 199 questions.
वेरी नाइस। और okay.
I
तो
will like
नेगेटिव मार्किंग तो होती है।
What I'm noticing, you
please.
must have also noted, sir, that majority of the students who have got in top 100 have attempted more than 197 questions.
हाँ जी,
This is the least we have heard is 198.
हाँ जी।
We haven't heard a figure. Also, Jay, everybody says run quicker towards the end. They say that many people will be able to reach very close to Usain Bolt's world record of 100 meters, but not even one person for next 50 years will be able to defeat him in the last 50 meters. So if you divide his timings of last 50 meters, they are practically impossible to defeat.
Yes, sir.
And that's what you did. You all escalated towards the end beautifully.
Yes, sir.
What was your strategy not to choke towards the end?
Sir, for that, the biggest role goes to my parents. They used to tell me कि इतना pressure मत ले, if अच्छा rank नहीं भी आया तो हमें कोई problem नहीं है. So main thing was कि किसी का pressure नहीं था. They were just like go with the flow. जो होगा अच्छा ही होगा.
So Jay, you just mentioned about the role of your parents, right? So
Yes,
I
sir.
will like to take you to a small story here, right? Let's remember this story about Lord Krishna. He was guiding Arjuna to shoot to the eye of the fish by looking in the water. नीचे पानी था, ऊपर मछली की आंख थी, पानी में देखना था और निशाना
Yes,
मारना
sir.
था आंख में। तो श्री कृष्ण ने अर्जुन को बोला पानी में ध्यान देना, आंख पे देखना, तीर जोर से खींचना, एकदम से मारना, साथ वालों को मत देखना, क्या कोई कर रहा है कुछ मत सोचना, अपना बेस्ट करना, तुम ये पहले भी कर चुके हो, विश्वास रखना, तुम मारोगे। तो अर्जुन ने बोला मैं तो एक इंसान हूं, आप भगवान हो, आप क्या करोगे? तो उन्होंने बोला आई विल होल्ड द वाटर स्टिल, ताकि तुम जब निशाना मारो पानी ना हिले। दैट्स द रोल ऑफ आवर पेरेंट्स.
Yes, sir.
So when you were trying to shoot Jai Shah Sahab, they were holding the water still for you so that you hit the ice. And you know, you returned it back with a glorious rank of 24. But it is
Thank you
just
so much.
the beginning. It is just the beginning. Come back. You are a very level-headed man. Come back. After 10 years, we will again talk to you of something bigger.
Yes, sir.
Your specialization, your achievements with the patients, your contribution of giving back to the society. The part 2 of this interview has to happen, Jay.
Yes, sir.
Great,
I'm
Jay.
sure
It's
that
been
we
great.
all will together on this.
Yes. Yeah. Jay, it's been great, and आपने बड़ी अच्छी बात बोली. First doctor in the family, and going ahead with a plan. And for all the doctors out there, especially मतलब discrimination नहीं, लेकिन ठीक है, all the first doctors in the family को हमेशा served out होता है. तो Jay is there as an example कि भाई अगर हम अपना रास्ता select कर लें, एक source select कर लें, जान लगा दें उसके पीछे, तो everything is possible with a proper planning and execution. ज़्यादा rocket science नहीं बनाना है. I think simplified रखा जाए चीजों को तो ज़्यादा better है.
Yes, sir.
Thank you, Jay, for your time. Thank you, Apu Mera sir, for joining us in this interview. It was great talking to all of you, and especially to young doctors. वो तो sir हमारे लिए, I mean, adrenaline है to talk to these guys and know how are they handling pressure, how are they handling everything.
Thank you so
You
much,
have
sir.
nailed
And
it. Fantastic.
thank you so much, sir. It was an honor to meet both of you. And thank you again. And thank you, PrepLadder.
Thanks, guys. Take care. Take care. Okay.
We are
Bye.
regards to your friendly and your parents. Bye. Thank you.
Okay. Bye, sir.
Okay. Signing. Bye. Bye. Take care. God bless you.